Good afternoon. Good afternoon from Berlin and welcome to this Population Europe webinar. I'm Daniela Vono and I'm going to be your host for this webinar today. Today we will look at the Generations and Gender program, a social science research infrastructure in Europe. It offers one of the most complete data sets to study individual life courses, relationships, families, and their children. Up to now, 20 countries have conducted at least one wave of the data collection. The GGP is now ready for a new round of data collection with an improved new questionnaire. I'm delighted that today Tom Emery, the Deputy Director of the GGP, is joining us in this webinar. He will present an overview of this new questionnaire, how it can be adapted to different languages and contexts, and what it will measure in terms of sustainable development goals. Tom, could you please start your camera and microphone now? Thank you. Welcome to you and thanks again for joining us today.
Thanks, Danielle.
Before I hand over to Tom, let me just briefly mention the agenda for this webinar. Tom will speak for about 30-40 minutes, and during his presentation, please take notes of questions you may have, because after the presentations, we will have a question and answer session during which you'll be able to ask your questions by typing them into a chat window that will appear then on your screen. In this session, we will be joined by my colleague Emily Lyons. We are now going to record this webinar and then it will be available online a few days afterwards, in case you want to share this with your colleagues. So now let me give the word to Tom.
Thank you, Daniela. So as Daniela mentioned, my name is Tom Emery. I'm the Deputy Director of the Generations and Gender Programme. And today I'm going to go over the development of the new questionnaire for the GGP. We're hoping to use in a new round of data collection starting from next year. At the end of the session, I'll provide you with a link to the questionnaire so you can actually see it online live, and also a printed copy printable copy of the questionnaire as well. But before you actually get to see the questionnaire, I'm going to take you on a bit of a journey and tell you a bit of the story of the development of the questionnaire and why we've made some of the changes that we've made. So to try and explain a bit of that context. So what I'm going to start with is talking a little bit about the genealogy of the new GGS questionnaire. We have a history that stretches back quite far, and it adds a lot of context as to why we decided to keep certain parts and why we decided to get rid of other parts of the questionnaire. Then I'll take you a bit through the actual process that we went through, the technical process of redesigning the questionnaire and how we've tested it so far. And then I will give you some of the highlights of the things that we've changed. Before, as I say, right at the end, we'll actually give you a copy of the questionnaire for you to look at and play around with. So where does this all fit in the history of the Generations and Gender Programme? So the tradition of cross-national data on fertility and family change is quite a long one, and it stretches back all the way to the 1970s with the World Fertility Survey, which was the first major cross-national study of fertility and family change. And then that was kind of taken on by the Family and Fertility Survey in the European context in the early 1990s. And then the GGS developed out of that in the early 2000s and turned into a longitudinal study with follow-ups every 3 years. What we're looking to do now is to extend that. Starting in 2020, our hope is to develop a new panel for the Generations and Gender Programme and refresh the data collection that has been ongoing for the last 50 years. So that's the plan. But to really understand that, it's worthwhile digging a little bit deeper into the history of the programme. So the World Fertility Survey, which started in the early 1970s, was run by the International Statistical Institute. And the main aim of the survey was really to develop more precise and comparative measures of fertility, maternal health, and these kind of issues that demographers were very concerned about at the time. The data was collected in actually a very kind of broad coverage approach with 42 developing countries and 20 developed countries collecting data, so 62 countries in all. But even at that time, the way the survey was operated was separated between those two groups. And for those of you familiar with demographic data generally, the developing countries surveys kind of separated off and went on today what's become the demographic health surveys. And the developed countries, the data coverage there went on to become the FFS first, and then the Generations and Gender Programme. This data, though, from the World Fertility Survey included fertility histories, some marriage histories, socioeconomic background and contraception, breastfeeding, and fertility preferences. It was very focused on health issues, but there wasn't much on complex sociological issues within that. And it was funded primarily by the US government, managed from the ISI in The Hague here, and run from the UK. But the data from this report, as I say, was very focused on the basic measurements of fertility histories and maternal health and these kind of basic demographic measures. So it was fairly limited in sociological scope. But this then moved on. As I say, they separated out between the developed and developing countries, which meant that the developed countries wanted to look at a survey that looked more at the demographic challenges they were facing, particularly addressing some of the sociological theories that were developing at the time to explain rapid decline in fertility, most primarily being the second demographic transition. So in the development of the FFS, there are attitudes and values added to the questionnaire, questions about people's preferences and their own perception of economic well-being and stability. And this was really to reflect the sociological thinking at the time and the major pressing policy issues faced by countries fielding the survey then. And they are quite distinct from the demographic health surveys that were covering the developing countries. So what we see now is, as I say, more values and attitudes, and also fertility preferences. So how many children people actually wanted and whether they were able to realize that specific number. Also with the FFS, though, it was still very female-focused in its understanding of fertility processes and family planning, and it was restricted to the age group 18 to 49, focused on those prime childbearing years. Because this is important in the context of the Generations and Gender Survey, which is what the program is still called today, which was set up in 2001 by the UNECE. And that's, as Daniela said, it's now actually run in 20 countries, and it spanned the East and West, really kind of bringing together in the kind of post-Cold War era, the East and West of Europe and the comparisons between those two. That was the real geographical focus of the previous round of data collection. It included family histories and marriage histories and all the same issues that had been in the FFS, but it extended these out, first of all by including intergenerational issues and extending the age range from 18 to 79, because aging was becoming an increasing demographic issue in Europe, but also by looking at the longitudinal realization of fertility. So for the first time, it became a longitudinal panel study, really asking people first in the first wave, how many children do you want to have in the next few years? And then seeing if they were able to realize that and seeing how people's attitudes and beliefs about family planning changed over time. And this is really to reflect on the influence of the theory of planned behavior, which was very predominant in demographic theory at the time. And so that brings us to where we are today. Now, the common thread through all of these surveys that we've done in the past has been the retrospective life history data. So the fertility histories and the partnership histories. And you can see here, this is data from Sweden. We can see two cohorts of people, one from the 1950s, one from the 1970s, and how their family patterns, their fertility progression, but also their marital status across the life course differs quite significantly. And what we can see through this collection of data sets that covers 50 years, we can compare a large number of different cohorts, and we want to extend that data collection out. A lot of this data now is actually available via secure administrative data access and things like IPAMs as well, who do a great job at providing great data on the basic demographic behavior like fertility and marriage behavior. However, what the GGS offers over and above this is an ability to see how this kind of behavior is really structured by things like preferences, attitudes, values, family household behavior, and economic uncertainty, which you can't get from administrative data. So to summarize this, the long history of fertility and family change that we're really building on within the GGP is the retrospective histories across the surveys, and they can reach right back now to the full post-war era. There has been a big shift over time, though, from basic demographics and health issues into values, attitudes, and decision-making. So a real change in the types of topics that we've been focusing on. And there's a shift from cross-sectional design to panel design. And this is actually going to be increasing in the new round as we have greater flexibility in the longitudinal design that we have. And this is able us to look more at causality and individual trajectories. There's also, what's quite evident from the data collections, it's a changing geographic focus of the studies. In the initial WFS, there was a real comparison between the developed and the developing countries. That evolved over time into a comparison of East and West, particularly in the context of the kind of post-Cold War era and the inclusion of new member states within the European Union. And this also simultaneously came alongside the evolution of the European research area, which the GGP is now a part of. However, the issues that we're facing are increasingly global. We see the same demographic issues in parts of East Asia and Latin America now, and North America, as we have done in Europe for the last 15 years. There has been considerable convergence. My graphic won't work at the moment, but there's been considerable convergence in the mean age of childbearing and the total fertility rate over time, with the total fertility rate falling in many, many countries and childbearing being delayed till later in life. And now if this graphic was working, what you would see is, first of all, those European countries first moving down to the left-hand corner and then over to the right as the mean age of childbearing increased. And then you would see quite clearly the Asian countries following them and those countries in Latin America as well. And this is really showing a global convergence, which means that we should be really asking similar questions in East Asia as we do in Europe and in Latin America. So this is really changing the focus of the GGP to more of a global level as well. So what we're trying to do within this new questionnaire design is build on a very long-running history of data collection. And that means we can't start entirely from scratch. We can't just throw everything else out, and we don't want to. We want to maintain that longitudinal continuity, and especially in the face of rapid and fundamental change. So we need to change the questionnaire to address new issues whilst maintaining this continuity. But what the question we faced when setting out to redesign the questionnaire was, what were the theories that we were faced with today? What were the questions that needed answering in social science and demographic theory? Just as the FFS had tried to address second demographic transition, and the GGP had looked at the theory of planned behavior. What were the key issues that scientists were looking at? And so what we did was, in this kind of redesign of the questionnaire, the first thing we did was we asked the GGP community what were the key issues that they were looking at now. And the list of questions that we came up with, there were three real key areas that were of theoretical concern to demographers that we identified. First of all was the effect of economic uncertainty. Particularly, we started this consultation many years ago, and particularly in the wake of the financial crisis, but also the changing nature of the labour market and economic conditions generally at the micro level. There is an increasing concern about how economic uncertainty affects family planning and individual demographic behaviour. And it's very difficult to extract that kind of information from administrative data, from IPAMs, and secure kind of administrative data access such as those. Alongside this, the second question that really came up was to understand the digitization of the life course, the influence of digital technologies on our demographic behaviour. So how dating websites can shape our partnership formation behaviour, and also how digital technologies can change the way in which we actually plan to have a family and realise our fertility intentions. And then finally, a major issue politically over the last 10 years has been migration. And there is a real interest to understand better how migration both influences and is influenced by family planning. And so we really need to, if the GGP is to address the key policy concerns going forward in the next 5 to 10 years, it really had to incorporate those key questions into its questionnaire design. And so that's where we started from. But there were also some additional issues that we wanted to ensure that we covered in this design process. We wanted to make sure that we extended the time coverage of this tradition of fertility data collection. We want to expand the global coverage under a realization that we live in an increasingly globalized world, and particularly in the science world. And there are increasing collaborations with researchers in East Asia and Latin America. And technologically, it's more and more possible to launch a cross-national survey of this kind. Then the third issue that we really wanted to address was the measuring specific sustainable development goals and see how we could contribute to this UN agenda. And I'll say a bit more about that later, about how we actually went about that. And then finally, we wanted to bridge data sources. I've mentioned administrative data once or twice, but there's also an increasing amount of digital trace data that's available via people's digital devices and the digital breadcrumbs that they leave behind. And we are well aware of the real value of this kind of data and what it can contribute to demographic research. And we wanted to integrate that into our data collection process, take advantage of its strengths when we can, but also to complement its strengths with the value of the survey data that we collect. So that's what we wanted to try and achieve with this new design. To start this process, as I say, it started many, many years ago, actually. The European Commission funded a design study for the GGP back in 2009. And as part of that design study, what we did in the GGP was to begin a consultation on the questionnaire to see what kind of new questions it should address. And this resulted in a revised questionnaire, which was then tested in 2012. However, because of the financial crisis and economic constraints, that questionnaire was never kind of fully taken to the field. And we had to wait again until we had a further project, which is the Generations and Gender Program Evaluate, Plan, Initiate Program, which we're currently conducting at the moment. And as part of that, what we did was we revised and updated that version of the questionnaire to take account of the issues I just mentioned. We did a wide, broad consultation, and then we tested the questionnaire in a pilot study. And now we're going through the amendments, ready to launch the questionnaire for the new round of data collection. So back to that design process that I put up earlier. Step one is to understand the objectives and resources and constraints of the data collection. And we've just talked about some of those now. The step two, though, is to determine the data collection method. And this has been a real key issue within not only the GGP, but many cross-national surveys. The way in which data is collected has changed massively since 2004, when we last did a data collection. That was a time when YouTube didn't even exist. The smartphone was still 4 or 5 years away from being launched, and that we lived in a very different world. So nowadays, it's web surveys, for example, are much more feasible, much more cost-effective, and actually open up a wide number of data integration opportunities that we wanted to take advantage of. So we've been looking increasingly at the ability to fill the GGP questionnaire via a web design. And so when we set about designing the questionnaire, we had that at the forefront of our mind, because we knew whatever questionnaire we designed had to be able to put into web. And when you consider the complex fertility and family histories that we collect, that's actually quite a challenge. In the previous rounds of data collection, in the World Fertility Survey and the Family and Fertility Survey, they were all done via face-to-face and processed via papers and pencils. This took a long time, was very inefficient, and there was a lot of room for error, basically. In the GGS, there was some paper and pencil still, but there was an increasing amount of CAPI and CATI integration, which are the computer-assisted personal interviews, so done via a tablet or a laptop, or a computer-assisted telephone interview. However, these weren't well integrated, but now we can actually field the survey right from here in The Hague, and it's a very integrated design. So no matter what language we're fielding it in which country, we're able to do it from one place in a fairly standardized way. And this really increases the quality of the data collected and reduces the cost quite considerably. But collecting a life history on a tablet, for example, when someone isn't actually a trained interviewer of themselves, is quite difficult. So you've got to make it intuitive, clear, and simple. And this isn't always easy. People have very complex life histories, and how they're recorded is really important. So to address this issue, what we did was we undertook a pilot study, and we did that in 3 separate countries. We did it in Germany, Portugal, and Croatia, and they represented some of the more challenging environments in Europe where this could be done, and to really see if we could fill the questionnaire online and get just as good quality family histories and personal histories from individuals as we would if we were doing a face-to-face interview with them. So what we did was we did some interviews via face-to-face, we did some interviews online, and we've been then comparing the results to see if the questions that we're asking actually able to capture the same quality data. So in the pilot study, what we've been doing is testing the new GGS questionnaire, looking at the actual response rates and the quality of the data that we've been getting out, and how big the measurement effects are. And also looking extensively at paradata, so how people actually navigate through the questionnaire to make sure that the questionnaire is as usable and robust as possible. And the results of this we've been taking forward and trying to understand better how we can improve the questionnaire. And on the back of these, we've been making a number of adjustments to the questionnaire. If you want to know a bit more about the methodological details and all the different technical things that we looked at, we'll be presenting the results of the pilot study at the European Sociological Research Association conference in Zagreb in July. But I'm not going to go into the methodology today, because that's for people of a particular taste, I think. So what we did then was we put the questionnaire and the results from the pilot to a questionnaire task force. Now, this questionnaire task force was made up of 3 experts from the GGP Consortium Board. So that's Martin Bouillard, Peter Luchtig, who's a survey researcher from Utrecht University, and Melinda Mills from Oxford University. And we took the results from the pilot and also data collection in Kazakhstan and Belarus. And based on the results that we had from these data collections, we made some small adjustments to the questionnaire to make it better applied online, simpler, clearer, and providing higher quality data. So we also made some adjustments to make sure that we were really up to date and relevant, providing relevant topic coverage, so that we were doing justice to the issues that we set out to measure. So that brings us to about step 6, step 7 in our process. And the consortium board of the GGP has now evaluated the questionnaire and approved its design. At the moment, what we're doing is we're doing the last few stages of coding of the questionnaire, and the questionnaire that I'll provide to you at the end of this webinar is a prototype exactly of that. But we're still working out the bugs and kinks before we actually release the data for the questionnaire for translation, ahead of new round of data collection which will be beginning this year and continuing for the next few years. And there'll be plenty of pre-testing and revisions to go before then. So where are we now with the new questionnaire? So what I'm going to do now is just run through those 3 areas that I mentioned before, the key topic areas, and explain a little bit of what we've done. I'll allow you at the end to look yourself through the details of the questionnaire and things that we've changed. But at the moment, I'll just cover these 3 topics. So the first thing that we looked at is the digitalization of the life course and how this has affected demographic behavior. One of the key things that we've actually introduced is a question about where people met their partner. Now, this is really crucial for understanding how partnership formation. What's really interesting, the thing that we've done here is we don't just ask this about a current partner, we also ask it about previous partners. So we're now asking in the partnership histories that we do have, how people actually met and whether they met online or via some other means. And this will help us understand how that has changed over time, and also some of the key demographic questions that we always have about relationship histories. So how stable are relationships that are developed online compared to those that are developed in a face-to-face setting? Are they less likely to end in marriage? Do they increase or decrease homophily? And how do these effects vary over time, across countries, and different contexts as well? How are they affected by internet penetration? And what's going to be really interesting to look at is, because this is retrospective data, we can actually see how the expansion of internet penetration has affected this over time, and not just with current relationships. So this will be a very interesting thing to look at. The other questions that we have regarding the digitalization of the life course, we introduced more questions on internet usage and access at home. So whether people, how often and how much they use the internet at home. But alongside that, what the centralized questionnaire will allow us to do, for those questionnaires that are filled out online, we'll be able to get device data and browser data to understand better people's actual usage of technology. And so these will help us better capture people's digital resources and skill sets. Okay, so the second area that we're looking at is economic uncertainty. Now, at the heart of this, what's really powerful is we've adapted a job coder that was developed for SHARE, the Survey of Health, Aging and Retirement in Europe, for the GGP. This was developed in collaboration with the Wage Indicator Survey. What this allows us to do is, now as people respond to the questionnaire, they can actually specify that their job title in the questionnaire, and these are automatically coded into ISCO codings for comparable comparisons, very accurate comparisons across countries, understanding people's very specific jobs. These are regularly updated as job titles change over time. And not only that, we can then link to data such as that from the wage indicator study and understand better what are the skill profiles of people in those professions, what are the average wages, and how they're associated with the educational level of the respondent. So this opens up a whole line of possibilities to understand labour market change within countries. And this is particularly useful when combined with a lot of new questions that we have in the section on work and income, which look more at economic uncertainty from a labour market perspective. So whether people are self-employed or not, how many hours per week they normally work, where they work, when they work, these kinds of things, and the flexibility that they have in their employment. But not only that, we're going to go further and try and understand exactly how much people work in other jobs, so not their main job, whether they get additional income from these other jobs, and how likely it is that they'll lose their job in the next 12 months. So quite a comprehensive battery of questions on uncertainty. And what this allows us to do then is combine that with the demographic data from the partnership and fertility histories, and really understand how these things affect demographic behaviour. The key research questions that this kind of data will help us answer is to look at how the uncertainty can reduce fertility intentions, for example, whether flexible work is associated with family planning, and whether it increases the stratification of family planning behaviour by education, and whether this effect is dependent on the sector of employment, for example. Really looking at issues, how the labour market changes are affecting family planning behaviour, and also how they're affected by context, because this data will all be cross-nationally comparable, and therefore we'll be able to see how in different countries these effects, whether they're stable or whether certain countries support such flexibility in different ways. So the third and final topic area that we wanted to try and address was migration and mobility. And in this section, what we look to do is go beyond a little bit of the basic questions of, are you a migrant, in which country were you born? And also, when did you move to the country? So these are fairly standard migration questions. But what we have done is we've standardized the way in which we capture these background questions, so they're much more comparable across countries in terms of the country coding and the language codings as well. So we ask, what language do you most frequently speak at home, to give a better sense of the level of integration of individuals. We also ask, though, about mobility, so which is goes hand in hand quite often with migration. So we ask, do you intend to move to another address within the next 3 years? Do you intend to move to another country within the next 3 years? And then respondents are able to specify whether it's likely, very unlikely, or unlikely. And this helps us really much better understand people's intention to move and the realization. We also look at their heritage and their background. So not just first generation migrants, but also second generation. So we ask every respondent where their mother was born and where their father was born, and whether, when they were a child, whether they spent any time abroad. So but when it comes to migration and mobility, the big advance in the next round will be that change in modes. If we're able to do more and more online data collection, this opens up the possibility, particularly in longitudinal data collections, of tracking people as they migrate across borders. So if someone is interviewed in a country in wave 1 and they move to another country before wave 2, we will still be able to chase them across borders and complete that interview for the second wave and understand why they moved and what the impact of that move has had on their family planning behaviour. And we can also, as we did in the last round, look at oversampling particular migrant groups and targeting these groups within the data collection to ensure we have oversampled and statistically robust populations to analyse migrants. In the previous round, for example, in Germany, the Turkish population was highly oversampled so that they could look at the particular subpopulation in quite a lot of detail. And the same was done with Poles in the Netherlands as well. The kinds of research questions that you can look at from these have a high policy relevance. Then we can look at how these intentions to migrate affect fertility intentions and how they're associated together. How does migration affect fertility intentions in the long run and the realization of these fertility intentions? And what factors actually affect the ability and the realization of people to migrate? And also, coming back to one of our previous topics, how migration and mobility is associated with both economic uncertainty and the digitalization of the life course, because these are key topics that are intertwining quite closely. And the final issue that I wanted to highlight today in the new questionnaire is the issue of the Sustainable Development Goals. So one of the things that we wanted to make sure that we did, where possible, was contribute to the UN's agenda on the Sustainable Development Goals, and particularly to ensure that there were robust measures, comparative measures, on particular issues of concern within the context of the Sustainable Development Goals. There are three key issues that we feel we contribute to uniquely in a cross-national context for developed countries. So first of all is the contraceptive prevalence amongst married or in-union women of reproductive age. Then we have the unmet need for family planning, which is quite a complex indicator to measure because it requires us to know quite a lot about not only the relationship status of an individual, but their sexual behavior and also their specific details about their contraceptive usage. And then finally, we looked at the prevalence of what are called modern methods of contraception in developed countries. This is data that is very hard to come by, especially from a kind of comparative perspective. And so we think this will be a key contribution of the GGP to understanding family planning behavior in today's context, especially when you take that hand in hand with the digitalization of the life course and economic uncertainty. Okay, so they're the main issues that we've addressed in the new questionnaire. What we're going to be doing now over the next few weeks is doing some final testing and then opening up for translation in various countries. It will be in the field later this year, and then over the next few years we'll be revising and developing new versions of the questionnaire, adapting it and improving it over time as the data collection is conducted in various countries. An online beta version of the questionnaire is actually available for testing if you just go to that link now. Don't go now because we've got the question and answer session now. And you can actually complete this by simply putting in two letters, followed by that should be two letters followed by 7 numbers. That should say in the ID. That will allow you to proceed with the questionnaire. And there's also a HTML version if you just want to do a control find and check what other issues are buried deep in the questionnaire. Okay, and if you have any comments or questions about the questionnaire, you can send them to the GGP email address here at NIDI. But that's all I've got for today. But I'm very eager to hear if any of you have any questions or comments regarding the new questionnaire.
Okay, I'm back. Let's see what are the questions. I can see someone is typing, but still didn't get it. So here we have the first question. Is the information about region people living in available? And if yes, on which level?
Yeah, so actually we mentioned region in several questions. So we don't just ask where people are living now. We don't just do that. We find out where people grew up as well. So that there's a question, which region of the country you actually grew up in. The specific NUTS level that is measured is determined more by data protection than it is by actual methodology. So it depends on a country by country basis. What we actually collect is very precise in the GGP, and so it will be on a geocoded basis. So from the sample, we'll know the country team, I should say, will know exactly where the person lives, and it's then up to us to simply simplify that down to the lowest level we can within data protection regulations, and then it'll be released. But we aim for nuts 2 at least within the GGP.
Okay, could you please explain how to follow GGP respondents over borders?
Mm-hmm. Yeah, so this depends on country by country basis and whether the data collection was done face to face or online in the first round. But because the questionnaire has now been adapted so that it does work online, if you can follow it by collecting information from respondents about their email address and their contact details in the first wave, it is then possible for them to fill out an online questionnaire in the second wave. And this makes it much more feasible.
Okay. Are you going to collect retrospective job histories with ISCO codes?
Currently, there are no plans to collect retrospective job histories with ISCO codes. We have been developing a specific job histories module that will be an optional module for countries to add. However, job histories are very difficult to collect. They take a lot of time. And so for us to insert those within the core questionnaire would have greatly increased its length and complexity. And so we decided not to include that in the core questionnaire.
Okay. Will the Sustainable Development Goals indicators on family planning be collected among unmarried women or women without a partner? This would mean that data on recent sexual activity is measured.
That is precisely correct. We will be collecting data on whether people have been sexually active recently.
Okay.
Yeah, there is a question in there that measures that.
What will be the expected duration to fill in the questionnaire?
So this varies, and it varies on a lot of different factors, especially the online questionnaire, depending on the device. But also, what the biggest factor is how complex your history has been. If you've had 9 partners and 20 kids, it's going to take you a while to fill in. But when we look at the averages, it averages out around 50 minutes for people to complete the questionnaire. And that's roughly the same between face-to-face and online.
Okay. How do you plan to conceptualize uncertainty? There are many ways, such as economic uncertainty, uncertainty about jobs, but also about environment and political situations, the latter being perhaps the most important.
Yeah, so what we're looking at in terms of uncertainty is particularly kind of people's individual, personal, economic uncertainty. So we do have questions about the likelihood of people losing their jobs, but also the stability of their actual economic activity within their current job. So the extent to which they know they have planned prescribed hours, the extent to which they have a fixed and permanent contract, or if it's a temporary contract. And what we want to do is do that in a standardized way across countries. We're not focusing on political instability. Doing that in a cross-national survey is really difficult to do. But if there were any suggestions about questions to add, then they can certainly submit them.
Okay. For the spouse and children, will you have places of residence, like country for non-cohabiting ones?
Right, so what we have is we definitely have it for the spouse. So we ask exactly the same questions to the spouse as we do about the respondent themselves. So we ask where they were born, when they moved here, and these kind of questions. What we don't have for the children, it has to be inferred from the residence of the parents at the time. So in terms of where the child was born, that would have to be reconstructed from the residential and mobility migration history of the parents.
Okay. What is the current situation of GGP in Latin America? What countries are committed to the GGP?
So currently there are plans to undertake the GGP. We have national team within Uruguay. There's some piloting that will be conducted later this year in Buenos Aires, in Argentina. And we have an active team with a funding proposal that's currently under consideration in Brazil as well. There is a lot of interest. At the moment, it's about kind of just increasing the profile of the GGP in the region. But there's a huge amount of interest.
Okay, what is the sample size per country? Is subnational, interregional comparison statistically possible?
So the sample size per country is heavily influenced by the national perspective. So the first thing I should note is that the age range of the GGP in this new round can be one of two things. So you can either do the full age range, which is 18 to 79, But if you've got an aging survey like Share, you can also restrict that to 18 to 49. Now that affects the total sample that you're going to need. If you have the 18 to 79, the target sample is 10,000, a net sample of 10,000. If you have a sample of an age range of 18 to 49, the target sample is just 5,000. Now, if there are specific interests within various countries to look at subregions and particular subregions of interest, or even subpopulations of interest, then we do recommend oversampling to enable you to do that. And so we would encourage any situation where that was of particular interest to increase the sample size to reflect that. So, for example, in Kazakhstan, they wanted to do exactly that. They wanted to go down to a very detailed sub-regional level, and they ended up completing over 13,000 interviews.
Okay. Is it possible to distinguish living apart together relationships and regular cross-border commuters?
So we do include living apart together relationships within the measurement of both in the measurement of current partnerships. But I'm not sure I understand completely the question about cross-border commuters. Yeah, so I'm not sure I understand the question fully. We do include information about large relationships, though. Yeah.
Okay, there are some more questions coming. So do you ask about year of naturalization?
So year of naturalization is going to have to be a country-specific question. There are some countries in the GGS where it's just simply not allowed to ask. It's a highly sensitive question. You only have to look at the debate currently going on in the US census debate to understand the sensitivity of that question in some context. However, where it's possible, it can be asked, and it can be added by national teams particularly interested in that issue. However, it's something we can't really enforce from a central perspective.
Okay. To what extent do you expect questionnaires to be totally harmonized across countries? Or will there be possibilities for the specific countries to integrate only parts or add more questions? So what about the flexibility?
Yeah, so there is actually quite a high degree of flexibility still. However, in the previous round, there was a large amount of flexibility, probably too much flexibility. So countries basically implemented the survey as and when they wanted. What we do now is it's highly centralized, and so we code the questionnaire centrally. What we try to do is strip back the questionnaire to the basic things that we think should be fielded in as many countries as possible. However, if countries have specific issues that they would like to introduce into the questionnaire because they have a certain relevance in their area, then we would be keen to integrate those questions in and also communicate that to the other countries participating to see if they're interested also in including those questions so that those specific questions can also be comparable. So, for example, at the moment, in the East Asian group of GGP countries, what they're currently looking at is the East Asian context has specific attitudes and values questions relevant for their region, and that they're looking at refining these to make sure that they're kind of incorporated in the questionnaires over there, and they have particular issues that they'll be looking at. And we would actively encourage GGP countries to kind of collaborate on these kind of sub-questionnaires and additional modules themselves. But you can't take things out without us approving it. So it's very difficult for us to actually cut questions.
Okay. Will there be applications of surveys for subsamples of specific groups of migrants, such as Turkish migrants in Germany? If yes, will the questionnaires differ for these groups?
So this will depend on the plans of national teams. So far, I'm not aware of any specific oversampling that is planned, but this is generally something that is added on later in the development stage anyway of the questionnaire. If a country was to do oversampling of particular migrant groups, we would be flexible in adding questions in to make sure that they reflected the specific migrant circumstance. So, for example, if they wanted a more detailed migrant history or they wanted more detailed questions about the specific circumstance, particularly like the question raised earlier about when citizenship was attained or something like that, then we'd be very open to adapting the questionnaire so that they could do that. But again, what we would focus on is doing it so it was done in a comparable way, so that if multiple countries did this, they would all do it in a standardized way.
Okay. How many countries are you currently expecting to participate?
So this is the question that we get asked the most, and it's the most difficult question to answer. So currently we have over 30 countries that have signed up to participate in the GGP, but that is entirely dependent on the extent to which they're successful in raising the financing to do the field work. We've worked very hard to make the GGP cost efficient and sustainable financially in the field work. However, obviously raising funds to do data collection in many countries is particularly difficult. However, we would be, at the current estimates, I would fully expect between at least as many countries as last time to participate.
Okay. Are there differences in the ways questions are framed between CAPI and CABI?
There are slight differences between the ways the questions are phrased between CAPI and CAWI. What we did was we took a web-first approach to the design of the questionnaire. So the idea being that it should be easily interpretable for someone filling it out themselves, and then that question could be applied in a face-to-face context. So what this really meant was we would strip back a lot of the instructions and detailed elaborations that were in previous rounds of the questionnaire, and now they're back to as simple as possible questions that are easily understood by the respondent. However, actually what we've done is we've changed slightly the instructions provided to the interviewer. So interviewer does get additional instructions at certain places, and these are clearly marked in the questionnaire. With some of the questions delivered face-to-face, what we've done to try and minimize the mode effects associated with doing online and face-to-face is actually to do what's called a CASI. So for those questions, the interviewer will turn around their laptop and the respondent will be able to fill in the answers themselves for those few select questions that are particularly sensitive or might elicit particularly extreme responses.
Okay. Can you summarize where the project stands in terms of insured funds and what is the roadmap in terms of ensuring such funding? It would also be useful to know how you see the planning implementation happening.
So in terms of the assured funds for the GGP central coordination, we are on a very financially sustainable footing. So for the actual coordination of the project, we can guarantee that for the next 3 years. So we will actually be able to provide the survey to fieldwork countries looking to field that. Within particular countries, there are many countries that are at a very, very advanced stage of financing the GGP, and some have already secured the financing to do so. And I won't go into too much detail on a country-by-country rundown. If you have any specific questions, I will answer them by email. But the coordination of the GGP itself is very sustainable. Yeah. Okay.
Are there further innovations in the area of data collection methods? Please mention if there are.
Innovations in data collection methods is something that we're looking at in quite a lot of detail, and we have we're looking at ways in which to actually introduce something of a quasi-innovation panel within the GGP over the coming years to ensure that we stay on top of these innovations. If there are specific innovations you would like me to talk about, I'd be happy to. But we will be looking at all different kinds within the new round of data collection. One of the big innovations that will be very interesting is to look at the paradata collected from this kind of data collection, because it's very rich and it tells us a lot about the data quality that we're getting in and how it varies across respondents.
Okay. Will there be also information on intergenerational financial support and debt within families?
Yes. So there's the degree of accuracy at which you can measure people's personal debt. It's something that's very difficult to do. So we don't actually ask for specific amounts of debt, but we do ask if the people are in arrears. In terms of intergenerational financial support, I mean, this is a topic that's very close to my own heart because I did my PhD in it. There are questions on intergenerational financial support within the questionnaire. I wouldn't cut those.
Okay. How close were the questionnaire in Belarus and Kazakhstan to the final questionnaire?
They were very close. So Belarus and Kazakhstan use a very advanced version of the new questionnaire. And there have been some slight modifications since the fielding there. They do implement the SDG measures that are included. I'm trying to think exactly what changed in between. but they do use it. Yeah, they use a very advanced version, so it's very comparable data. And what we will be doing is mapping that data to the new data collection so that it is entirely comparable, and they will be included in the new round of data collection.
What kind of social support network questions are included? What kind of theoretical basis is used for them?
So the social network questions were actually one of the issues that was most difficult to address, especially considering a move online. What we previously envisaged in the consultation that happened from 2009 to 2012 was a very extensive social network module in which an entire social network was mapped across individuals. This performed really poorly when we tried it online, and so we weren't able to develop full mapping of people's social networks. It became very intensive for respondents to fill out, and they simply skipped through it. And we got a lot of break-offs as well. What is also very complicated in collecting that kind of social network data is adapting it so that it's viable across multiple different devices. So we had to test everything so it worked on a desktop computer right through to a smartphone, because a lot of people do like to complete the survey now with just a smartphone. And when we were thinking about more complex social network measures, these weren't actually achievable via a smartphone device. So what we've stripped it back to now is we include all the various different items of exchange and support that were previously in the questionnaire. So whether that's financial support, emotional support, help with childcare, help with care generally, and all the, help with housework, and all these items. These are all included, and you can identify the relationship between the respondent and the recipient or provider. But we haven't got a name generator system that's similar to Share, because this just wasn't applicable in a multi-mode design.
Okay. Besides Paradata, is there any other digital trace data collected?
This is something we're looking at, but it's going to have to be done on a country by country basis, because the digital trace environment is heavily restricted by borders. So if you take something like Facebook, for example, whilst it is a major international company, the context of Facebook does vary from country to country, and that's also constrained by the legal protections and the nature of the consent that is required in some countries. We're quite lucky in Europe that that's been relatively standardized by GDPR, but even within Europe, that still becomes complicated, and it would have to be done on a country-by-country basis. We're very open to new innovations in digital trace data, and including these within the questionnaire, but they're going to have to be handled on a country-by-country basis. So it's not within the standardized questionnaire, but it's something that we're looking at doing.
Okay. Can you please get an indication on the response rate?
From what, the pilot?
It can be.
I'm going to assume that you mean the pilot. So within the pilot, we in the online data collection from the pilot, we got 54% response rate in Croatia. We got a 40% response rate in Germany, which is comparable generally to face-to-face in Germany, even though that's quite low. Response rates are very low in Germany. And in Portugal, there were a number of issues with the sampling framework used, and therefore the response rate online was only 35%. Now, what the recommendations will come with in terms of the move online, they've still yet to be specified by the consortium board. So we're still doing a kind of cautious approach over the next few months of exactly how, what constraints we'll place on a kind of mixed mode approach to data collection. But what one of the key elements will be a focus on the quality of the sampling frame.
Okay. How do you see subsequent waves planning out?
So now we've completed the first round of the revisions to the questionnaire for the first wave. In the next few months, we'll be starting the process of evaluating the wave 2 questionnaire, and there'll be a little bit more room in there because most of the data collected in the first wave won't change. It's not time variant data necessarily, and so there'll be a bit of room in there for some new modules, maybe the job histories that we talked about before. But we're currently opening a consultation to consider what could be in there. But also, by potentially moving online, there is also scope for more iterative and like testing new modules in between waves as well, keeping in touch with people and fielding questions in between waves. As I mentioned before, we are currently looking at developing an innovation panel within the GGP to test these kind of new questions and see what kind of new questions we could field in the future.
Okay. Does household rosters include questions on the current location of the family members, or only current household members are considered?
Okay, so the household roster, obviously, it only includes people in the household. But what we do include is information about people's broader family. So we ask extensive questions about mothers and fathers and where they live and the contact frequency and the relationship with them. And we also ask questions about the number of about grandparents and about siblings as well. So it's not just contained within the household.
Will the second wave refill the younger adult ages?
So that's very much a question for national teams in terms of how they envisage the design playing out in the future. Each country has is going to have its own kind of design as to how they see the GGP being fully implemented in their country. So the GGP has always had a design of doing at least 3 waves. So the idea is that countries will continue doing data collection for 3 waves. Whether they do refreshment and whether they do more waves than those 3 waves, which refreshment will be particularly useful for, it has to be a matter of kind of national priority about what they see the strategic direction of the GGP in their country for. But for cross-national comparability, what we ask for is, at a minimum, a country fields the first wave and then does 2 subsequent follow-up waves.
Okay, have you established a specific duration for data collections in each country?
Specific duration. I mean, specific durations are highly dependent on the national context and the fieldwork agency. Some countries it can be, if it's done in an online environment, for example, you can have data collection finished within 6 weeks. In other kinds of environments, though, where, for example, when we did data collection recently in Kazakhstan, it took 6 months because they did a vast number of interviews across a very difficult environment. And so their data collection did take substantially longer. But this has to be kind of structured by the national circumstances. In terms of the overall fieldwork window for the GGP has always worked a bit more flexibly than with a lot of surveys, in that not all surveys need to be conducted at exactly the same time. Because of the focus both on the retrospective nature of the life histories, but also because we're looking at changes within people over time, rather than providing, say, for example, a snapshot of what people's attitudes are to the European Union in 2019. Therefore, we do allow a degree of flexibility in when countries actually field. So they won't all necessarily be at the exact same time. Having said that, what you notice between the World Fertility Survey, the FFS, the GGP, is that fieldwork window has been slowly closing. With the WFS, it was from 1972 right through to 1984. By the time of the GGP, all first waves were collected within a much tighter time frame, and we're looking to kind of keep that even tighter for the next round.
Great, so we are going to finalize the webinar now. Thank you very much for all participants for this exciting debate at the end of the presentation. Thank you, Tom, so much for being here with us today and presenting the innovations of the new GGP round. And for those who would like to continue the conversation with you, I guess you are happy to receive emails, right?
We're always happy to receive emails. Yeah. Any suggestions for the wave 2 would be greatly received.
Great. So thank you so much for everyone and have a nice day.
Thank you.